The coronavirus pandemic has caused the nation and the world to recognize the critical role that pharmacists are playing in the fight against COVID-19, from working in labs developing vaccines and antiviral drugs, to providing statewide advocacy and education, to serving some of the sickest patients in critical care units. The CU Skaggs School of Pharmacy and Pharmaceutical Sciences is proud to introduce you to just a few of our pharmacists on the front lines.
It's completely changed how we're managing patients, mainly from the standpoint that, our resources are very limited. Half the patients with coronavirus or SARS-CoV-2 or COVID-19, whatever you want to call it, are in our intensive care units. So you're talking, an enormous volume of new patients coming to our ICUs. COVID patients usually have one issue, and it's coronavirus, and it's really wreaking havoc on their lungs, in their anticoagulation system, and oftentimes their kidneys as well. Care dynamics are very different in a COVID patient because we're trying to think of not only the well-being of the patient, but also the healthcare providers that are providing care for the patient. So we're thinking about the medications that we're selecting that, if there's an alternative to a medication that's longer acting, that means that the nurse doesn't have to go into a sick coronavirus patient's room as often as they need to. And then just working with experimental therapies such as hydroxychloroquine, Kaletra, remdesivir, all these agents that don't really have definitive benefit yet, but at least we can advocate for the safe and appropriate use of them. We get 4 years of dedicated drug education. A lot of other professions, they're lucky if they get 1 to 2 semesters. So we really are the preeminent drug experts, and we're relied upon to serve that role. I got an email from the director of the ICU saying, you're the only consistent presence across all these COVID teams because they're trying to recruit as many physicians as possible to help manage. The director said, you know how appropriate care is supposed to be implemented in these patients in terms of ICU medications. And so please advocate for your patients. So it means a lot to me to hear that from the director of the medical intensive care unit. At least in the ICU, we're almost like a silent presence because if you think about it, most of the patients that we're managing are on very aggressive breathing machines and requiring high amounts of sedation. So they're not really necessarily aware of anyone's presence, let alone pharmacy's presence. But I like to think of ourselves as almost the guardian angels that are looking after those patients, even when they can't see or hear or feel or understand what's going on, to know that they have someone advocating for them in terms of their medications. I had a conversation with my wife about this before we entered the COVID unit. We had to make a decision of, what to do as far as, the risk of me bringing home the virus. My wife and child decided to live with their parents for the week, just to kind of have that extra degree of separation. And I take every precaution. So this is a new set of scrubs, actually. So I shower every time I get home. I change into new scrubs. I have a set of coronavirus shoes that I do not wear into the house. They stay either in the car or in the hospital. So there's just extra sets of precautions that we're taking. But the risk is there and the risk is real. But at the same time, I felt like this was my calling. This is why I went into intensive care pharmacy, was to help heal and optimize care for patients. And, like I said earlier, this is when we're needed. If you're interested in pharmacy, I know that it's a very dynamic time to be in medicine, but with any tough times that the country's facing and the world's facing, that's when the need is most. And, I invite anyone that's interested in a pharmacy to rise to the occasion and to give it its serious consideration. Once this whole virus thing passes over, and if there are any students that are interested, they're more than welcome to spend a couple days with me shadowing to see what pharmacists do firsthand.